Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Imagine something so fundamental, seemingly safe, that you rely on it every single day, without even thinking about it. I mean, something as invisible as the water flowing right from your tap. What if I told you that even at levels currently considered safe, this everyday thing might be silently influencing the very beginnings of new life, potentially impacting infant health, maybe right here in your community? Welcome to the Deep Dive. Today, we're pulling back the curtain on a really fascinating and frankly, kind of concerning new study. We'll distill the most important insights from a recent health news article and the detailed scientific paper it's based on, both just published this month, June 2025. Our mission is basically to help us all understand what's truly going on beneath the surface of this, pretty critical public health issue. So let's dive right into the core of this discovery. We're talking about arsenic in public drinking water. Now, for many people, that might sound like a problem from, a far-off disaster zone, or maybe something that only affects private wells. But this deep dive shows it's much closer to home than you might think. It's affecting public water systems right across the United States.
Yeah, and what's truly fascinating here, I think, is how the researchers specifically looked at levels of arsenic that are below the current federal safety standard. The United States Environmental Protection Agency has this maximum contaminant level. It's 10 micrograms per liter for arsenic in public water. This study really makes us ask an important question about what safe exposure truly means anymore.
That's a crucial distinction, yeah. If I'm understanding correctly, a lot of the previous research focused more on private wells, maybe smaller areas. But this study aimed to look at the bigger picture, the public water systems. How did they even begin to tackle something that huge?
Indeed. The main objective here was to evaluate that link, that association between prenatal exposure to arsenic in public water, specifically at those levels below the EPA's limit, and birth outcomes across the U.S. And to do this, they assembled a truly massive cohort. They analyzed data from nearly 14,000 mother-infant pairs.
14,000. Wow.
Yeah, from 35 different pregnancy study sites all across the U.S. These participants are part of a larger initiative. It's called the Environmental Influences on Child Health Outcomes Cohort, or ECHO. And the infants were born between 2005 and 2020. So this wide scope, it allows for a much more comprehensive look across diverse populations, which is, frankly, pretty rare for environmental health studies like this.
Okay, but how did they actually figure out the exposure levels for all those people? I mean, it's not like they could test everyone's kitchen tap water, right?
Yeah, right. That's a great question. And it really highlights the ingenuity you need for a study this big. Crucially, the researchers estimated the arsenic exposure during pregnancy for each participant. So instead of testing every single tap, which, would be impossible, they used existing water quality data from large geographical areas, basically zip code areas. They combined this public data with where the participants actually lived during their pregnancy. So just to be clear, no actual arsenic levels were tested from these individual participants' water. It was a modeling approach using large-scale data, but it gives a broad and really crucial picture.
Okay, that makes sense.
Yeah.
Given that huge amount of data, what were the specific health outcomes they were looking for in the babies? What were they measuring?
They focused on three main indicators of what we call adverse birth outcomes. First was preterm birth, so babies born before 37 weeks of gestation. Second, low birth weight, which is defined as babies weighing less than 2,500 grams, that's about 5.5 pounds. And third, small for gestational age. This identifies babies who are, smaller than you'd expect for how many weeks the pregnancy lasted compared to a reference group. They also use something called Z-score for birth weight. Think of it like this. It helps compare apples to apples. It tells you if a baby's weight is genuinely small or average or large for its specific age in the womb. That's really vital, especially when you're looking at preterm births,
Right. Context is everything.
Yeah.
And what did this incredibly detailed study actually find? The results, I have to say, reading through it, they were genuinely surprising.
They absolutely were. I mean, the truly astonishing finding was that even at concentrations way below what we currently call safe specifically, below 5 micrograms per liter, which is only half the federal standard, higher prenatal arsenic exposure in public water was directly linked to lower birth weight. It was also associated with a reduced birth weight for gestational age Z-score and just a higher risk of low birth weight overall. It's a finding that really demands our attention because it suggests effects at levels many people, even regulators, might consider negligible.
Wow. And did this impact everyone the same way? Or were there like specific groups that showed higher risks?
That's another important layer. The study broke down these impacts, and it really shows the complexity of environmental health. So the risk of low birth weight per microgram per liter higher arsenic was elevated among Black, Hispanic, or Latino and white birthing parents. So pretty broad impact there. Hispanic or Latino birthing parents, for example, also showed a higher risk for preterm births specifically. Interestingly, the actual average reduction in weight, the mean difference in birth weight, was more pronounced among white birthing parents. They saw about a 10-gram decrease per 1 microgram per liter higher arsenic. But it's also really important to note the study confirmed what others have shown. Babies born to Black parents faced higher overall risks of being born early, having low birth weight, or being smaller than expected compared to babies born to white parents. And this baseline disparity was also seen across several other racial and ethnic groups, including American Indian, Alaska Native, Native Hawaiian, and Pacific Islander parents. However, the study didn't find that the public drinking water arsenic was sort of the reason for those baseline disparities between groups. It didn't mediate them. It was more like an additional factor, another burden contributing to the overall health picture.
Okay, those numbers are stark. But the implications, they feel even more profound. This isn't just numbers in a paper, right? It's a direct challenge to the policies governing the water flowing into our homes, schools, everywhere. First, though, just quickly for our listeners, could you remind us where arsenic in water actually comes from? Is it pollution?
Well, it can be, but often it's natural. Arsenic occurs naturally when water underground comes into contact with certain types of rocks and soils. It's just part of the geology in many regions. But yes, it can also come from various industrial processes or agricultural runoff, which then adds to what's in the water systems.
Okay. And this study, as you said, really challenges our current standards.
Yeah.
The EPA's limit is 10 micrograms per liter. And these findings suggest even that might be inadequately protective, as the paper puts it, for birth outcomes.
Precisely. And if you look around, other places have already moved on this. New Jersey, New Hampshire, even Denmark. They all set their maximum levels at 5 micrograms per liter, half the U.S. federal standard.
Half. Wow.
Yeah. And the Netherlands goes even further. Their standard is just 1 microgram per liter. It's also worth remembering that the EPA's own goal for arsenic, the maximum contaminant level goal, is actually 0. Zero, which basically acknowledges that from a pure public health standpoint, there's no truly safe level of exposure to arsenic. The reason the regulatory limit, the enforceable one, is higher is because the agency has to consider other things too. Factors like the cost of treatment and whether the technology is feasible everywhere, not just the health benefits.
Right, the practicalities.
Yeah.
Which brings us to potential actions. If these findings hold up, and if they're taken seriously, then lowering that arsenic limit further could be a really important tangible step to improve infant health across the whole country. What kind of interventions are mentioned in the sources? How could we actually reduce exposure?
Well, the sources mention a few promising ideas for exposure reduction. One is household filtration programs, providing or subsidizing water filters that are certified to remove arsenic right at the tap. Imagine the impact if those were widespread, especially in higher risk areas.
It sounds direct, yeah.
Another idea is clinic-based prenatal water testing programs, sort of like what they've tried successfully in New Jersey, but for private wells there. Imagine, a pregnant person goes for a checkup, gets offered a simple water test for their home, and then gets clear guidance if the levels are high. These are concrete, pretty implementable steps.
That seems like a really practical way to reach people directly, right, where they're getting health care. And it sounds like some communities might benefit more immediately than others.
Absolutely. The research really highlights that public drinking water arsenic tends to be highest in rural communities, particularly in the Southwest and the Midwest here in the U.S. And when you look at specific populations, American Indian or Alaska Native communities, and also Hispanic or Latino communities, they disproportionately face higher exposure levels. This often ties into things like, older infrastructure or maybe historical underinvestment in water treatment in those specific areas. These communities represent really key opportunities for targeted interventions, maybe using those healthcare appointments as a touch point. And if you connect this to the bigger picture, these kinds of contaminants like arsenic, they're directly relevant for child health. And they are things that could be readily modified by federal regulatory action, yet they often remain kind of underappreciated, maybe understudied in the broader field of environmental epidemiology. It really raises an important question, I think, about how we prioritize our investments in public health infrastructure and where we focus our efforts to get the most impact, especially for the health of our most vulnerable populations.
Okay, but like any good deep dive, we need to acknowledge the edges, right? The limits of what we know. No study is perfect. Understanding the limitations, I think, helps us appreciate the findings even more, puts them in context.
Absolutely. That's a critical part of understanding any research, especially large-scale studies like this one. For instance, the sheer scale meant they had to estimate exposure using those zip code level water data points, not individual tap tests. Now, while that's a solid approach for looking at large populations, it does mean we don't know for sure if a specific individual mostly drank bottled water, for example.
Or maybe the water at their workplace was different.
Exactly. They just didn't have enough data to figure out if participants mainly drank tap versus bottled water. That individual behavior piece is missing.
Okay, so that's one major caveat. What else should we keep in mind when thinking about these results?
Another important one, and it's a bit subtle, is something called live birth bias. Basically, if very high arsenic concentrations might unfortunately lead to miscarriage or stillbirth, those pregnancies wouldn't end up in a study like this, which only looks at live births.
I see. So the study is only looking at pregnancies that made it to term.
Precisely. And this could potentially skew the results we see among those live births, because the most severely affected outcomes, the ones that never resulted in a live birth, they aren't part of the data set. It means the findings might even possibly underestimate the full impact of arsenic on overall reproductive health.
That's a really important point.
Yeah. And there are other things too, like other sources of arsenic exposure weren't looked at here. Things like some types of rice, for example, can contain arsenic that wasn't evaluated. And they also didn't have data on relevant dietary factors or supplements like folate or vitamin B12 intake, which can actually influence how the body processes arsenic. And finally, while this ICCO cohort is diverse in many ways, it might not be perfectly representative of the entire U.S. population in all aspects. For instance, the preterm birth rates in the study group were actually a bit lower than the national average, so that could slightly influence how broadly we can generalize some of these findings.
Okay, so we've taken quite a journey, haven't we, into this hidden world within our drinking water. It really turns out that even these seemingly low levels of arsenic, levels below our current fetal safety standards, might be, well, nudging infant health in the wrong direction, affecting birth weight, other critical outcomes right at the start of life. It's easy to look at these numbers as just, abstract data points. But when you think about it potentially impacting the very first moments of life, that really hits home, doesn't it?
It truly does. And my hope really is that this deep dive encourages you, our listeners, to think critically, to think about all the environmental factors that shape our health, especially for the most vulnerable among us, like infants. Knowledge is most valuable when we understand it and can apply it, right? And this study provides a really significant piece of that puzzle.
So, given these findings, what does this mean for you, for your community? How do we as a society balance safety and cost and feasibility when we're talking about something as absolutely fundamental as clean water for the next generation? This isn't just a scientific problem anymore, is it? It feels like a societal challenge, one that really invites further action both locally and federally, and probably more investment in our public health infrastructure. Thank you so much for joining us on this deep dive today. Keep exploring, keep asking questions, and keep being curious about the world around.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.